Thank you for joining the Mannix New Prater Vision Correction webinar today. Mannix New Prater has been serving Southwest Missouri for more than 2 decades and offering advances and new technology and vision correction procedures. And so today we're going to talk about some of those vision correction procedures like LASIK. I'm sure a number of you have heard that word. PRK, refractive lens exchange, and then advances in cataract surgery. It's my pleasure to have Dr. Jake Thomas join us. Dr. Jake Thomas is one of the doctors at Maddox New Prater, and he is a fellowship trained ophthalmologist in corneal and refractive surgery. Dr. Thomas is going to talk to us about the number of options that are available today. We also have in this webinar a Q&A section. It should be on your screen. So if you have questions today that you'd like for Dr. Thomas to address, feel free at any time during the presentation to put those questions into the Q&A section. And at the end, if we have time, we'll try to address as many of those questions as possible. Again, we appreciate you joining us. It's going to be fun today to explore your eye health and the options that you have today for vision correction. With that, I'd like to turn it over to Dr. Jacob Thomas. Dr. Thomas, thanks for joining us today, and I'll give it to you.
Well, Bill, thank you for your time and thank you for that nice introduction. We're really excited to talk about a subject in which I have a great passion, and that's ways to help people improve their quality of life through vision correction surgery. As far as the history of our practice, we started in 1999 when 4 surgeons, Dr. Maddox, Prater, Leo New, and Ken New, founded the practice. We've expanded to have 5 locations throughout the Ozarks, and we were the innovators to bring many of these procedures to town and are proud to continue to advance the technology that is available here in the Ozarks. As far as our surgeons, we have several surgeons that are available to provide the latest in eye surgery and medical treatments for cataracts, LASIK, PRK. Also, we treat things like macular degeneration and glaucoma, so we try and provide as many services as possible for our patients to make it convenient for them. As far as about myself, I grew up here in Springfield. I went to high school here, and then went to Drury, and then went to the University of Missouri for medical school, and then went down to Dallas at UT Southwestern for my residency in ophthalmology and cornea surgery. In our practice, we try and provide comprehensive eye surgical services, including all the refractive surgeries, cataract surgery, and the minimally invasive glaucoma surgeries. So in the coming section, we're going to go over some of the most common vision correction procedures and kind of the conditions that they are able to help us treat. What's really exciting about this era of eye surgery is we are able to provide a wide range of services for the various populations of our community. Many of our patients are growing older and are starting to develop cataract, and that provides a real opportunity to help improve a person's quality of life. But also, people on the younger age of the age spectrum have a variety of options that can help improve their quality of life as well. To start off, I think a good analogy to describe the eye is it's very similar to a camera, where a camera has a series of lenses that allow light to pass through it and then focus that light onto a film where an image is created. The 2 lenses in the eye are the cornea. The cornea is the first surface that light encounters when it enters the eye, and that's where the greatest amount of refraction or the bending of light occurs, and that's where a variety of these surgeries are done. The lens in the eye is behind the iris, and that also has some options to treat errors in the way light enters the eye. The purpose of those lenses is to focus the light onto the retina. The retina is a neurological tissue that makes an image that then goes to the optic nerve in the brain. And so there are what we call refractive errors, is a generic term for the way where light is focused in an area that's not on the retina. And this can be a very complex and overwhelming topic. And it's something that to go into all the details would be beyond the scope of this webinar. But it can be broken down into a few main forms of refractive error. Myopia is where another term for nearsightedness, and that involves light being reflected in front of the retina. That involves the eye being too long or the cornea being too steep. Hyperopia is different, where the focal point of light is behind the retina, and that has to do with the eye being too short or the cornea too flat. And what we see with hyperopia or farsighted people is they have no focal point at where they have a clear image. And so these people need glasses for all their activities, in contrast to myopia, where they have a focal point at some point in the front of them where they can see clearly, whether it's an inch in front of them or 2 feet in front of them. There is a focal point where it's clear, versus hyperopia where is not a clear focus point. And then astigmatism is another common problem, where the cornea is shaped like a football, where it is longer or in one direction than another. It can also happen if the eye is too long. And this leads to multiple focal points on the retina, which creates a clear and indistinct image. We can fix these things and these refractive errors with a variety of technologies. I mentioned earlier that the cornea is the clear window on the front part of the eye. Reshaping the cornea allows us to correct refractive errors with the least amount of risk, because we don't actually have to enter the eye like we do with other surgeries. And so this really works real well for people with nearsightedness or astigmatism. PRK achieves a similar result to LASIK. LASIK, as you can see here on these slides, has a flap that we make with one laser. We then elevate that flap and then use a second laser to sculpt a person's prescription into the eye. We then put that flap back down. That flap allows a more rapid recovery with less pain, but one of the downsides of that is that if a person has a trauma to the eye, that flap could be injured. PRK involves brushing the cells off the surface of the eye and then applying the sculpting laser directly to the cornea. Those cells then have to grow back, which takes usually 3 to 4 days. So during that time, the eye is a little uncomfortable and the vision's not real clear. But the big benefit is that once it heals, there's no flap to worry about. So we recommend that in people with high impact lifestyles, people in martial arts or in law enforcement or the military, where they can have trauma to their eyes. And then also with people with thinner corneas do well with this, because there's no flap, there's more corneal tissue left behind. This treats nearsightedness and astigmatism very well. A refractive lens exchange involves making small openings in the cornea and then going in and removing the natural clear lens inside the eye. This is an option for people that are not candidates for LASIK. Our ability to treat farsightedness is much less than our ability to treat astigmatism or nearsightedness. So this works well for people that are over 50 with hyperopia or significant amounts of astigmatism. And it can also address something called presbyopia, where people in their 40s everybody will end up needing reading glasses up close, even if they have perfect distance vision, because the lens loses its flexibility to see far away and up close. That's called presbyopia, and the refractive lens exchange introduces options to treat that problem. Cataract surgery also allows us to fix some of these refractive errors. A cataract is when the lens in the eye goes from being clear to being brown and cloudy. It derives from a Latin term for waterfall called cataracta, and it, I think, came from people feeling like they were looking through a waterfall whenever they developed cataracts. This happens to everybody if they live long enough. The technology is improved to where we have lens implants that can build a person's prescription into the eye when the cataract is taken out. And that can allow us to treat many of the same problems that LASIK can with a lens implant. And also, that's another reason why when people get older and start to develop cataracts, we typically suggest cataract surgery if the cataract's limiting their vision, because we can achieve the same results with cataract surgery as what we achieve with LASIK or any of the other refractive surgery options. When we have people call in asking about options to decrease their need for glasses, we are often thinking about the different options, or the patients are thinking about the different options, where it's PRK, LASIK, or refractive lens exchange. And so the main difference between these is the part of the eye that's being treated. LASIK and PRK are modifying the shape of the cornea with laser technology, whereas a refractive lens exchange involves making openings in the eye to remove a person's clear lens. When you open the eye to the external environment, you introduce a very small risk of problems like retinal detachment and infection. It's very low risk, but not zero risk. And so that is something that we typically wait until people are in their over the age of 45 and usually in their 50s before bringing that up, because they're closer to that age when they would start to develop cataracts. All of these procedures can fix astigmatism. LASIK and PRK can fix it with reshaping the cornea to fix that astigmatism, to make it to where that cornea creates one focal point instead of the multiple focal points you'll have with astigmatism. With cataract surgery and refractive lens exchange, we can fix that with toric lens implants, where the astigmatism is built into the lens implant rather than into contacts or glasses, and it's an internal lens inside the eye that stays there, so it fixes it all the time, so you don't have to take the contacts in and out like you do with contacts. It's there all the time, so you always have that corrected. As far as how long the procedures take, it's usually a fairly quick procedure. As far as the time you're in the building, a big thing that we try and focus on is patient comfort. And so with all of these procedures, we give sedative to make a person comfortable. So we don't start the procedure until that sedative is working and patients are feeling comfortable. We give medications to numb the eye, and we don't start the procedure till the eye is numb, because we want people to have a good experience. So my part of the surgery actually probably takes the shortest amount of time that a person's in the building. They're usually in the building for a couple hours because we want the sedatives to be working and the eye numb. But my part where I'm actually doing the work is a smaller portion of that, because the comfort is one of our top priorities. The sedative really helps people feel more comfortable. The medications we give anesthetize the eye so that the eye is comfortable, and we try and make it as pain-free as possible. We've been doing this a long time, so we are experienced with trying to provide a pain-free experience for patients. We found that pain is one of the things that patients are most concerned about when they think about eye surgery. So we really try to go to great lengths to make it a positive experience with little pain. As far as limitations on activities after these procedures, it's mainly we ask people to take it easy for a week, where we don't want them getting hit in the eye or doing any kind of significant activity where they could have trauma. Light cardiovascular activities are okay, but we usually suggest not going out to run a marathon or do any kind of kickboxing or anything like that for a while. But usually just kind of common sense things of light activities with taking precautions to limit the chances of trauma to the eye. And then we have people on eye drops afterwards to limit the chances of infection and inflammation. Will I still need cataract surgery in the future if I have a refractive lens exchange? What we're doing with a refractive lens exchange is we're removing a person's lens before they develop a cataract. And so once that lens is removed, you don't have to worry about a cataract developing. That lens has been treated and is gone. It's somewhat dependent on the age at which you have the surgery. As people get older, they can develop other problems in their eye. So if you have a refractive lens exchange at age 55 and you make it to age 80, then things like glaucoma, macular degeneration that you're genetically predisposed to developing can occur, and that can sometimes cause a person to need other eye care. But as far as care for the lens implant stays in there and the cataracts do not develop. And then are these procedures permanent, or do I need to have them done multiple times? That's a great question. There is variability with any procedure. When we do LASIK or PRK, the chances of us getting all of the treatment corrected with one procedure is well over 95%, but that means that anywhere from 3 to 5% of people will need to have an enhancement or a touch-up. That's included in the price a person pays. When you look at all our data at 1 year, there's well over a 99% chance of being outside of the glasses and contacts once everything is healed up. Now, as far as having things done multiple times, if a person's 25 and they have their LASIK, and then they come in 40 years later, they can still develop cataracts and other age-related eye issues that happen to us all as we get older. And so, for example, if you have it when you're 25 and then you come in when you're 50, you will develop presbyopia where you start needing reading glasses. And in that situation, that is an age-related issue that's happened just through natural aging. And in that situation, there are ways to address that with PRK or other surgical options to help minimize a person's need for reading glasses. Are there any side effects from the different procedures? Everything has a risk to it. I tell patients the only thing that's risk-free are glasses. I see far more people lose vision from contact lens related infections than I do from any of these procedures. That's a very common issue, whereas with our treatment program afterwards, we do not, it'd be very uncommon to have an infection. I've not had one in my career after LASIK or PRK. With cataract surgery, I've done this for 13 years now, and I've had one infection after cataract surgery. And so the chances are well less than 1 in 1,000 of those complications. The complications from things like contacts are much higher than that. So infection's the main risk we worry about. So we have you on eye drops to limit that risk. Dryness is common after all these procedures. That fades as everything heals. And typically by 4 to 6 weeks, that dryness is starting to subside. And then glared halos can be common after LASIK and PRK for the first few weeks, but that also fades as everything heals. And so all these things have risk, but I think they are less risky than many of the other options out there for visual correction. How long is the recovery time for these procedures? LASIK provides the quickest recovery. People often are seeing well within a couple of days of LASIK surgery. PRK takes longer because the cells we brush away have to grow back. And so during that time, the vision is blurry. You have a medical contact that stays in place for 4 days with PRK. Once we take that out, the vision really starts to improve. And then things like cataract surgery, we have people take it easy for a week. Cataract surgery is often dependent on how severe a cataract is. Some people come in with very advanced cataracts, and advanced cataracts can take a while to heal, sometimes a week or two, sometimes even longer. Whereas mild cataracts tend to heal more rapidly and people regain their vision much more quickly, often within a few days. So it is somewhat dependent on the conditions we're treating, but as far as activities, most people are able to return to normal activities within a week. Will I be able to see both near and distance after the procedure? That's a great question. And it's dependent on the age at which you have these procedures. If you're less than age 45 with LASIK or PRK, people often have that full range of vision. After age 45, you go through natural aging changes where the lens loses its flexibility to see far away and up close. So that's when you start seeing people start to need reading glasses. There are ways around that where we can do things like monovision, where we have one eye up close, one eye far away. The technology for multifocal contacts and multifocal lens implants has improved dramatically. And now those lenses are able to give people a more full range of vision when they have cataract surgery or refractive lens exchange. The prior versions of that lens would at times cause glare and halos when people drove at nighttime. The manufacturers have really concentrated on those concerns, and now the newer materials and the newer versions of those lens implants have a far lower incidence of glare and halos after multifocal lens implant cataract surgeries. So multifocal can give you that full range of vision after cataract surgery. If you have a traditional monofocal lens, then you could either do the monovision, where one eye's up close or one eye far away, like we do with LASIK, or you could have both eyes set for distance. And in that situation, you need some reading glasses. The cost of the procedure is something that people often ask about. We do everything we can to try and make it affordable, but these technologies, the companies that make the lens implants and the lasers are proud of it. And so depends on the procedure and the condition we're treating, but we certainly do our best to make it within the range of most patients' budgets. And we also have various options for financing with Care Credit and other programs for people that want to explore those options. And as far as insurance coverages, most of these procedures, like LASIK and PRK, are not covered by insurances. Traditional cataract surgery is often covered by insurance, and insurances cover the traditional monofocal lenses that give people good distance vision. Multifocal lenses and the astigmatism correcting lenses called toric lenses are typically not covered, and there's an out-of-pocket investment for those. Cost of those is often in the range of what new glasses would cost over the course of a person's lifetime. So often people find like that investment to limit a person's need for glasses and contacts after the surgery is worth the investment. As far as your candidacy for these procedures, the big thing on these is doing a thorough evaluation, assessing the entire health of the eye. So we take a variety of images to determine the health of your eye, and we look for conditions that would cause you to have problems after the surgery. We then can make a recommendation. We can do things like LASIK on people with any age, depending on whether or not they've had cataract. And so there are all kinds of options through a full range of things. Conversely, things like cataract surgery, we usually wait till people are older and they've developed the cataract, and then refractive lens exchange is something that we typically wait till somebody's in their upper 40s or 50s before bringing up that option. People are happier with that option once they fully develop presbyopia, which usually happens in the upper 40s and 50s. As far as why you should choose our practice for these procedures, I think what distinguishes us from other practices is our focus on the latest technology. And then we also really try to do everything we possibly can to minimize a patient's discomfort and provide them with a good experience. We were the first to bring many of these procedures to the area. We continue to try and lead and innovate and introduce these new procedures once there are data that they are effective and that they are safe. And so we are confident in the products that we're offering can provide good results for our patients. This is the contact information for our practice. We're happy to schedule consultations to go over your options and assess your candidacy.
Dr. Thomas, thank you very much. That was an excellent program, and I hope that you who have joined us today also enjoyed it. We've got a couple of questions that have come in. If you have just a minute or two left, Dr. Thomas, if we could answer these.
I'd be happy to answer questions.
Well, good. So one of our questions that came in was, can I have LASIK if I've had a cataract diagnosis?
Whether you could, but if it was me, I would rather, you can achieve the same results with cataract surgery as what we can do with LASIK. And so if a person has a significant cataract, I usually suggest they do not spend their money on LASIK and instead address the cataract, and you kind of kill two birds with one stone, as the saying goes.
Great. Here's another question from the audience today. Do you have a preference for PRK that you've mentioned over LASIK for a specific age range, or does it depend on the person's prescription?
It depends on a variety of factors for people, and also for lifestyle being one of the more concerning things. When you do LASIK, you make a flap on the cornea that removes 20% more of the corneal tissue. And so for people with high treatments, doing LASIK on them could potentially destabilize their eye. So in high prescriptions, we often will suggest the PRK if they're outside the treatment range for LASIK. As far as lifestyle goes, for people that are in high impact professions where they would have a chance of damaging their eyes through trauma, then we usually suggest the PRK over LASIK. And then younger people are still developing the natural strength of their eyes. So for people that are under 20, we will usually suggest PRK rather than LASIK to preserve more tissue as their eye matures.
Great. Just a couple more questions. You spoke of glare or halos. Can you explain those and how they affect your vision during a procedure or after a procedure?
The glare with the cornea surgeries typically has to do with healing of the flap. And as that heals and the flap heals and the cells of the eye heal, that glare diminishes. It also diminishes as people get older because their pupils tend to be smaller as they get older. As far as glare with cataract surgery, the multifocal lens implants work because they have many concentric rings that divide the light up to give a full range of vision. But one of the trade-offs of those rings is it can cause some glare with nighttime driving. The newer versions of these lenses have improved to where that is a infrequent problem. And the people that do notice it generally feel like the reading vision they get from it is worth it. But that is that can be a concern with the multifocal lenses.
Okay, and then another question. My friend had a light adjustable lens, or what we refer to as an LAL. Do they need to wear glasses? And what happens if they don't wear glasses? And how does an LAL or a light adjustable lens work?
Well, the adjustable lens is a great technology that's come out that's allowed us to adjust a person's lens prescription after the lens is in the eye. In the past, when people had a lens implant in the eye, if they developed residual prescription, then the only way to treat that would be to go back in the operating room and do LASIK. With the adjustable lens, there is a molecule built into the lens that can be reshaped with an ultraviolet light. And so that's why we have people wear the special LAL glasses, is to shield them from that ultraviolet light. And so traditional sunglasses block some ultraviolet light, but they weren't approved by the FDA to block the light that is needed to protect the light adjustable lens. And so we recommend wearing the glasses from SightRx because those have been shown and proven by the FDA to protect the lens. But with the adjustable lenses, that allows us to modify a person's prescription afterwards to customize it to give people better up close vision or distance vision. So it can really make monovision more accurate. It can optimize a person's distance vision and can help us treat people with atypical eyes.
How long do you have to wear these sunglasses after your procedure?
The adjustable lens we do start adjustments usually 4 weeks after the surgery, and you can adjust it up to 3 times, and then it takes 2 lock-in treatments to make it permanent. So after the last lock-in treatment, a person can stop wearing their glasses.
Well, again, let me say thank you for your time today. I think this was an excellent program and really a way to talk about these life-changing possibilities for vision correction for really all ages. So I want to thank you. Also want to thank Maddox New Prater and the team there that helped set this up for the audience today. Thanks everyone for attending and have a great day.
Thank you.